Hello, everyone. This is Dr. Manit Arora. I'm a senior consultant, orthopedic and sports medicine surgeon at Fortis Hospital, Mohali. And basically, the topic we kept today was Olympic injuries, seeing as the Olympics just happened. And I'm sure all of us are a bit interested in what's been going on regarding why people have been getting injured and how come we haven't been getting as many medals as we had hoped for. So there's three sort of players I wanted to talk about, and one is Harmanpreet Singh, who is the captain of the Indian hockey team. The second is Mirabai, and the third is Vinesh Fogart. So I think these are the three most interesting cases to discuss. So we'll start with Harmanpreet Singh. So he's the captain of the Indian hockey team, and basically he came to me about 4 years ago, before the Tokyo Olympics, 6 months before the Tokyo Olympics. He'd had a ligament tear in his knee, and he'd also had a meniscus tear, or a tear of the shock absorber in the knee. So what I did was we fixed his ACL and we fixed his meniscus. And normally now we tell people that getting back to sports after a ligament surgery or a meniscus surgery takes about 8 to 9 months. So in his case, he was very, very dedicated. He was very, very committed. And from day one, he made it clear to us that, look, whatever happens, I'm going to get back to this Olympics. So that's the willpower of the athlete. That's the athlete pushing themselves through the rehab, through the recovery, sometimes against our advice, but that's the psychological role that it plays, right? So I think for him, it was a remarkable journey because in 4 months after his surgery, he was able to go back to sports. Well, back to the training camp in Bangalore. He took a flight to the Tokyo Olympics, and I'm sure all of you remember that he was a leading goal scorer in the tournament there. And since then, he became Indian Player of the Year, then World Player of the Year, and then probably the best penalty corner specialist in the world. He got promoted to captain of the team, and just recently, now with the Paris Olympics, India were able to get a bronze medal in Indian hockey. So back-to-back medals after a very long time for Indian hockey, which is, as we all know, um, cricket is the national sport, but hockey is the nation's sport. So it's the sport that all of us have our emotions stuck to, and there's a different type of pride that comes with winning hockey games. So it's been a remarkable journey for Harmanpreet, and we wish him the best in his journey going forward. And there's a couple of important points from this. One is the willpower of the athlete to get back to sport and overcome an injury. And there's a lot of athletes that we know, for example, Yuvraj Singh, where injuries impacted their performance and ended up in them finishing their career. So here, it's been that the injury has not impacted his performance. The surgeries allowed him to get back to sports and get back to sports at a good level. The second case I wanted to talk about was Mirabai. So Mirabai made a proclamation after losing her match that it was due to periods, and that she'd lost um, the match with her opponent due to the fact that she was mid-cycle in her periods. So that's not an excuse. That should never be an excuse. There are so many female athletes in the world. There's competitions that happen every month, and it's a high performance sport. And invariably, epidemiologically, you're going to end up with a lot of people at any given point in time in any competition being on their periods. And we cannot blame that for the reason why they do not perform. In fact, research has shown us that having periods should not impact your performance. And if you have an abnormal period or an abnormal menstrual cycle, then definitely that can hinder your performance. But just having periods, so there's so many tournaments that go through 2 to 3 months with so many female athletes playing. If it was just for the fact that people with periods can't perform, we would have a lower performance across all sports. So I'm sorry, I do not buy this excuse. I think that um, you know we deserve better, and we deserve people that do not blame their injuries or they don't blame their performance on the fact of being on a period. So, and I think that's not the athlete's fault. I think that's the where the medical team really needs to step up with their care, because even if they have periods, there's ways that we as sports medicine doctors can manage those things to ensure that there is no impact on performance. So I think that collectively the support staff in that case needs to do better to make sure that the athlete can continue to perform. And if they're having pain or if they're having cramps, then there's easy ways to manage those problems. But blaming having a normal menstrual cycle as the reason why you lost, I don't think that is justified. The third one is, of course, Fogut. So Fogut is the one that got the most publicity, and there was never a need for double weigh-ins before the Paris Olympics. Paris Olympics is the first Olympics where double weigh-ins have happened. Otherwise, it used to just be one weigh-in a day. And irrespective of that, I think that again, this is less the athlete, because the athlete is concerned with, playing their sport, they're concerned with performance, they're concerned with giving it all there. It is more the support staff. So I think in that case, the support staff needs to definitely keep a better eye on what is happening, and how we can manage her weight during the day. And I mean, this is not the first competition she's been in, and this is not the first competition that any athlete has been in. So how many other disqualifications happened due to weight during the Paris Olympics? Hardly any. So this is something that I think is a serious thing, because if the support staff are not trained enough, and if the player themselves should also keep a better watch as to what they're doing. But of course, I don't blame her, because her that's not her job. Her job is to perform. It's the job of the support staff to ensure that she performs while staying within the Olympic rules. And I think that's where the support staff really faltered. So I think collectively, if we look at these Olympics, one thing that it's taught us is that Indian sport is on the rise. Unfortunately, our medals did not show that, but we do know that the ground infrastructure is improving. Hand in hand with that, injuries are going to happen, but those injuries need to be dealt with. And whenever there's a tournament, so the support staff needs to be much better than what it has been at these Olympics. So I'm sure we can give them plaudits that they've done a tremendous job, and look at the rest of the athletes, how well they've done. But I think collectively as a group, we sort of need to introspect here and make sure that these sort of little mini fiascos don't happen again at the next Olympics, and that we're able to give better performance boosted by the support staff rather than hindered by the support staff. So, my suggestion to the Indian Olympic Association would be, you got to have a look at the sort of medical care that you're offering athletes, and especially at major tournaments like the Commonwealth Games and Olympic Games. And I think we can do better. And I think as the audience, we deserve better, and we deserve our athletes to have the access to, when we're spending so much taxpayers' money on them, then we also deserve that taxpayers' money is also used to boost up the performance of the support staff, to ensure that we get those medals, to bring some happiness into our lives. Good. So, does anyone have any questions? So, I think collectively, been a learning Olympics for all of us, and we aim to get better. So, how do I find out about questions? Okay, great. But it's live, right? Yeah, good. So I'm done with talking. Mhm. Yep. So I think the important thing is that this Olympics has been about a learning experience for us as medical people, in terms of that sometimes the spotlight is thrown on us, and we all need to step up our game. So if athletes are stepping up their game and giving it their all, I think the support staff also needs to step up their game and give it their all. And I hope that when LA Olympics comes around next time, that collectively as a group, athletes and support staff and medical staff will be able to do a much better job than what we did in these Olympics, and probably bring home some more medals for Team India. Thank you so much.